you suffer from symptoms of low thyroid? Hi, I'm Dr. Thad Deal, and in our office we see a lot of people who are suffering from low thyroid symptoms despite being medicated. Either that or they have all the symptoms of low thyroid and are told over and over again that their lab tests are normal. Here's just a brief video and explanation why. Your pituitary gland tells your thyroid to make thyroid hormone. The way it does that is by sending out the hormone TSH. So that tells your thyroid to produce thyroid hormone. Now this is usually the only test that your doctor is going to run, and it's the marker they're going to use to determine the efficacy of your treatment. The problem with this, one, lab ranges are non-standardized, meaning they can vary from lab to lab, and also they're overly broad. They're bell curve analysis throughout the low end, the high end, and more important than that is there's not a single study that shows that having a normal TSH rules out you having a thyroid problem. You need to look at the person's symptomatic presentation. Many doctors are more interested in manipulating lab values than they are caring for their patients. Here's the rest of the story and why many people on thyroid replacement still have all the symptoms of low thyroid function. TSH tells your thyroid to make T4 and a little bit of T3. 4 molecules of iodine and 3 molecules of iodine respectively. As I mentioned, most of it at this point is T4. So if your T4 is low, your TSH will go up. If it goes above the point to which your doctor deems significant, you're going to be given synthetic T4 to raise this value back up, and then it will raise this TSH value back down into the range that they're comfortable with, and then you're fixed. The problem is this doesn't fix most people. All you're really doing is manipulating this TSH number using synthetic T4. Again, you have to look at the patient's symptoms. The reason why many people continue to suffer is your body actually prefers or requires T3. So your body needs to be able to convert that T4 into T3, and many people don't do that very efficiently for a variety of reasons. So many patients would do better on a combination of T4 and T3, or maybe T3. There's a number of other problems that can arise. The number one cause of low thyroid function in this country is an autoimmune mechanism called Hashimotos disease. And they rarely check for it because it doesn't change their treatment for you. All they're going to do is give you synthetic T4 level at roxanne, Synthroid, based solely off your TSH levels. The issue is that the underlying cause of your thyroid problem is an autoimmune condition, meaning your immune system's attacking and destroying your thyroid. And there's things that can and need to be done about that, but no one is doing that. No one is addressing that. There's a lot of other problems that can exist, and the only way to find them is by doing a full thyroid panel. Why don't they do a full thyroid panel? Again, because it doesn't change their treatment for you. And this is unfortunate because I see so many women who continue to suffer with this model. And that's why we've taken it upon ourselves to dig deeper to help you find the underlying root causes and support you so that you can recover from thyroid problems and other chronic health problems. So if you're interested in finding out more about our comprehensive support program for people suffering with thyroid problems, I invite you to call our office, 814-238-0232. Thanks.